Hi everyone, this is Dr. Rich from the College at Brockport. I want to give you a quick little review on cardiodynamics, and I'm going to focus on our last lab in what some of the things you should know in preparation for your lab exam. I'm going to really encourage you to review the last cardiodynamics review that I prepared. There's 5 slides there. You should also review stroke volume. I made a reasonably informative, I hope, YouTube video for stroke volume, and then another one on the electrocardiogram. I think all of those are worth watching and taking notes or just really paying attention to. Okay, so here's where I want to start. This equation right here. Flow is proportional to pressure divided by resistance. This little symbol here is not meant to screw you up. That just means is proportional to. So we can see that flow is proportional to pressure. That means more pressure, more flow. This works for water going through a garden hose. It works for your shower. So if you have good flow, meaning you have good water pressure, you're going to have a good shower. Secondly, flow is inversely proportional to resistance. That means when resistance increases, flow decreases. An increase in resistance, let's say due to a narrowing of the pipes in your house, means your shower's not going to be as good. You know what I'm talking about if you have an old house without anyone around who's handy to replace those pipes. Flow is reduced when you have arteriosclerosis. So arteriosclerosis is the stiffening of the arteries as you age. Atherosclerosis is an advanced stiffening of the arteries, probably because there's cholesterol deposits. What that means is there's more resistance to flow. More resistance to flow. Those arteries have in effect narrowed, and flow rate decreases. This can lead to chest pain or angina. Now, specifically, when we talk about cardiodynamics, here's the equation. It's identical, but we've used terms that we're more familiar with. So flow is proportional to blood pressure and inversely proportional to peripheral resistance. So when Jim was at the start of his race, when he was sprinting, his blood pressure went way up. We know his pressure is high because the textbook says so. We have a figure in the textbook. Oh, I can't remember the page. I believe it's 734. I'm leafing through the textbook right now. And it is. On page 734 in the textbook, it tells you that a trained athlete, when they're going full out, has a blood pressure of 200 over 90 millimeters of mercury. That means his systolic is quite high, 200 millimeters of mercury. And that means that blood is really going to be pushed quickly through the blood vessels. So let's take a quick look at this flow diagram. And this is really how I analyze that big table for the race. What we know is cardiac output is equal to heart rate times stroke volume, right? That's an equation that I have you memorize. And sorry for the sort of crummy handwriting, but we know cardiac output is equal to heart rate times stroke volume. What controls heart rate? Well, mostly the autonomic nervous system. Parasympathetic, using acetylcholine, slows it down. Sympathetic, using epinephrine, speeds it up. So Jim uses his sympathetic nervous system when he's competing. That's one really important message. The sympathetic nervous system not only increases heart rate, it's going to have, we call it a positive inotropic effect on stroke volume. It is going to increase stroke volume, and it does that by increasing contractility. It's also going to increase preload, and we'll talk about that in just a minute. Stroke volume is also influenced by end diastolic volume. That's the maximum volume of the heart, and that's influenced by venous return. We increase venous return, we increase EDV, and we increase stroke volume. All of these will enhance cardiac output. So let's take a look at the slide. Here we go. This is pretty tough. So let's only talk about before the race. We know that Jim's heart rate is elevated. It's 85 compared to 65 at rest. So I would draw an up arrow. That means it's increased. And one arrow means a little bit. What about stroke volume? Well, we just saw that the sympathetic nervous system increases stroke volume. There we go. We know it increases stroke volume because it's probably going to decrease end systolic volume, right? And that's because the heart is going to beat more strongly when epinephrine binds to receptors on the cardiac myocytes, causing an increase in intracellular calcium. Now, will it increase? Will that sympathetic activity increase end diastolic volume? That's really a maybe. If we increased venous return, it would increase EDV. I'm going to say I don't think there's an appreciable effect. You could argue, though, that sympathetic tone will increase the rigidity of the blood vessels so that blood pressure goes up, and that could increase venous return, but I'm going to say no. Okay, what about preload? No, it doesn't increase because we've not increased EDV. Contractility, yes, that's increased. Sorry, I just made that slide jump. What about afterload? Well, I think so. Afterload's going to increase, right? And that's because blood pressure increases. Peripheral resistance, does that increase? I would say yes. Sympathetic nervous system increases tone of your blood vessels, correct? And we know his respiratory rate is up, but not dramatically. So again, respiratory rate, due to the respiratory pump, will increase venous return. But this is a modest increase in respiratory rate. There's going to be a modest effect on venous return, but I'm going to say it's small, it's not dramatic. Now contrast this with 1 minute into the race. We know Jim's heart rate is really jacked up, right? It's at about 208. I'm going to give that 3 upward arrows. That's maximum stimulation. We know he's enhanced his cardiac output, right? Because the textbook tells us that for a trained athlete, cardiac output is going to go from roughly 5 liters per minute at rest to 30 liters per minute when it's really maximally stimulated. So the question is, what happens to stroke volume? Now, everyone is worried, as you should be, that we've decreased the amount of time for a cardiac cycle. When we decrease the amount of time for a cardiac cycle, we've really decreased EDV. When we decrease time in the cardiac cycle, we've really decreased the time in diastole. We've also decreased the time in systole, but proportionally, the effects are greater on diastole. That means there's less time for cardiac filling. I don't think that's a major effect here. I'll tell you why. We're up at 201 beats per minute. It's a healthy heart. These healthy hearts are very stretchable. They're compliant. Now, if we get up to 208 during a sprint, now we're starting to decrease the amount of time for filling. I think there's a tipping point. I'm going to say stroke volume is dramatically increased. I'd call it 3 pluses or 3 upward arrows. Now, what about ESV? Well, you know we've decreased that, right? We're maximized. I've changed the thickness of the line. That's a little bit better. We've decreased ESV because we're contracting much more powerfully. We've also increased EDV. Now, why is this? This is not intuitive. We have to consider 2 things. One is decreased filling time because of the shorter duration of a cardiac cycle. So that's going to have a negative influence on EDV. There's just less time to fill. However, our blood pressure has doubled. Now it's at 200 millimeters of mercury systolic. That's really going to increase flow from that equation. Flow is proportional to pressure divided by resistance. So I think that flow wins the day here. Preload, that's going to increase, right? Because EDV is increased. Contractility, that's an up, most definitely. Afterload, well, that has to be up, doesn't it? Because pressure is up, peripheral resistance, Anytime you maximally activate your sympathetic nervous system, peripheral resistance is going to increase. Respiratory rate. Now this guy he's really wheezing, right? He's breathing so hard. So there you go. That's how I work through it. This is not easy stuff. I want to say something about peripheral resistance as well. The sympathetic nervous system will generally increase peripheral resistance. That's for sure. Now, how is it if we increase peripheral resistance that really important, active, metabolically active muscles can get blood? Well, they do that by autoregulation and this concept of local control. This is important. This local control will almost always beat out the autonomic nervous system when competing for blood. Local control will cause arterioles that perfuse these metabolically active muscles to relax. They will cause the smooth muscles to relax in the walls of those arterioles, and what that means is we've got a lot of pressure. Peripheral resistance all around the body is high, but it gets lower for those blood vessels that perfuse the muscles that are working. That means those muscles can really receive an enormous supply of blood and therefore become nourished with oxygen and other important metabolites, and waste will be removed. So that's very important. Now I want to say one more thing quickly before we're done. Your sympathetic nervous system is high, peripheral resistance is high, except the resistance in those arterioles that supply blood to the metabolically active muscle. Now the resistance in those few blood vessels has dropped. What happens when you stop the exercise? What happened when Jim finished the sprint? They got across the finish line and he slumped over. His blood pressure dropped pretty quickly. The reason that it dropped is because all of a sudden we didn't have that huge autonomic tone for the sympathetic nervous system. So peripheral resistance drops. Your heart rate is normally high enough to continue to perfuse your brain so you don't get dizzy. But if it's not, or if you've got heart trouble, although we're not really talking about that, all of a sudden opening those vascular beds is going to cause a drop in blood pressure. That's going to make you feel faint. Okay, so I hope that this helps you to understand peripheral resistance and the way it influences blood pressure. So whenever blood pressure is higher, peripheral resistance is probably higher. Whenever blood pressure is higher, your heart is probably pumping faster and more powerfully. There's a balance when we're filling the heart in between time and flow rate. And you just have to consider that. There's no easy, simple way around it, except to really reason your way through it. Okay, this is longer than I wanted. I hope that it's helpful. I'll see you tonight at 4. Bye-bye.